Welcome to SSR Pharma Media, your trusted source for pharma knowledge. Pharmaceutical Inorganic Chemistry. So, PIC MCQ series, your exam power boost. Today we are going to discuss about Haematinics. Prepare, practice, succeed. Haematinics. So, in the Haematinics, we are going to discuss about these compounds. So, ferrous sulfate, ferrous fumarate, ferric ammonium citrate, ferrous ascorbate, and carbonyl ion. So these are all the compounds, so inorganic compounds used for the treatment of, it is used as a hematinic, that means used for the treatment of anemia, various different types of iron deficiency anemia. Then what is hematinic? So hematinics are substances that promote the formation of hemoglobin and red blood cells and are used in the prevention and treatment of anemia, especially iron deficiency anemia. So hematinics is used for the iron deficient anemia only. So there are different types of anemias are there, but hematinics is used for iron deficiency anemia. And in that hematinics, so these are all the types of hematinics: source iron, maceration factors, and adjuvant hematinics. So in iron, source of hematinics are used in the two forms: oral iron supplement and parenteral iron supplements. So these are all the examples for oral iron supplements, and these are all the examples for parenteral iron supplements. And in maceration factors, so other than iron, some compounds are used as a hematinics. So for example, vitamin B12, maceration factor vitamin B12, cyanogobalamin, hydroxogobalamine, methylgobalamine, and folic acid, folinic acid. And adjuvant hematonics are copper, pyridoxine, and riboflavin. So these are all also used as a hematinic. It is for the different types of anemia. But iron compounds are only used for the iron deficiency anemia. So these are all used for the different types of anemia, like sickle cell anemia and intrinsic factor deficiency anemia. For that purpose, these are all the maturation factor and adjuvant hematinics are used for the treatment of anemia. So now we will see about the introduction about iron. And iron, what is doing, how it is converting in our body after taking through food source or in the tablets form, what it's going in what happening in our body. So that we will discuss over here. So iron is essential for synthesis of hemoglobin, myoglobin, and cytochromes and enzymes. So it's mainly absorption site of the iron is duodenum, and the absorbed form is ferrous form. So iron is absorbed in the ferrous form. So here heme iron converted into ferrous form, inorganic iron converted into ferric form. It must be reduced to ferrous form. And ascorbic acids and gastric acid increases the absorption of iron. So when we are taking iron supplement along with the ascorbic acid, and it increases the gastric acid absorption. And alkalis, phosphates, and phytates, and tetracyclines, so these are all the compound decreases the iron absorption. So acidic compounds increases the iron absorption, alkaline compounds decreases the iron absorption. And transport of protein, so it is transported, ions are transported, so it is called transport protein. It converted into transferrin. By combining with the transport protein, iron combines with the transport protein and it forms transferrin. Then storage form of iron is called ferritin. So storage form of iron is called ferritin, and hemosiderin, excess of ions are converted into, so excess of ion converted into hemostatin. And storage site of iron is mucosal cell, liver, spleen, bone marrow. So from there iron utilized for the hemoglobin synthesis. And the parental iron indicated when oral iron not tolerated or not absorbed or with erythropoietin symptoms are there. So in that case we'll go for the parental iron supplement. So parental iron preparations: iron dextran, iron sorbitol citrate. So it's mainly given in the IV or IM, intramuscular or intravenous. So iron sorbitol citrate is mainly given in the IM only, not IV, because it leads iron toxicity when we are giving through IV route. The total iron requirement is, this is the formula, 4.3 into body weight kg into HB deficient. So when iron excess in our body, so that leads the iron poison. So for that iron poisons, antidote we need to give. So the antidote for iron poisoning, acute iron poisoning, is desferoxamine. Then chronic iron overloaded, so it is called thalassemia. So overloaded iron is called deferriprone. It is a type of oral chelator. So next is the clinical uses of iron salt. Treatment of iron deficiency anemia due to chronic blood loss. So clinical use of iron salt, treatment of iron deficiency anemia due to chronic blood loss, menorrhagia, hookworm, colon cancer, and increased demand in pregnancy as well as infancy, poor diet intake, malabsorptions like gastrectomy, celiac disease, and when ions are absorbed in the ferric form and it's converted into ferrous form. So ferric form is absorption increases in the presence of ascorbic acid. Physiological role of iron. Iron is essential for hemoglobin synthesis. It is an oxygen transporter, component of myoglobin, oxygen storage in muscles, and required for cytochromes and oxidative enzymes, important for cellular respirations and energy production, support immune function and normal cognitive development. So next move on to the questions. Haematinics are drugs used primarily for, so option B, prevention and treatment of anemia. So hematinic promote hemoglobin RBC formation, hence used in anemia, especially iron deficiency anemia. The principal site of iron absorption in the gastrointestinal tract is, so option C, duodenum. So iron absorbed mainly in the duodenum, partially in its ferrous form. Which form of iron is best absorbed from the intestine? So option B, ferrous form. So only ferrous form iron is readily absorbed. Ferric iron must be reduced first. So ferric form is reduced into ferrous form in acidic conditions, then ferrous form is absorbed. Which of the following increases iron absorption? So ascorbic acid is acidic conditions, so iron is absorbed. So iron is absorbed in the ferric form. In the acidic conditions, these absorbed ions are reduced into ferrous form and enhances iron absorption. Iron transported in plasma mainly bound to transferrin. So option C is a transferrin. Transferrin is a plasma transporter protein that carries iron to tissues. The major storage form of iron in the body is, so option B, ferritin. So iron stored primarily as a ferritin. Excess iron is stored as a hemocere- stored as a hemoseridin. Ferritin is the main physiological storage form of iron in the body. It is a soluble protein complex that safely stores iron in tissues such as liver, spleen, bone marrow. The transferrin transporter ion, hemoglobin utilizes iron, and hemoseridin represent excess and insoluble iron storage. Parenteral iron therapy is indicated in all except. So option B. So intolerance to oral iron. So all except intolerance to oral iron. Which parenteral iron preparation should not be given intravenously? So option B. Iron and sorbitol citrate is not given intravenously IV route because it produces iron toxicity due to free iron. Which parenteral iron preparation should not be given intravenously? So it is again repeating, I think so. So the option B, iron and sorbitol citrate. The antidote used in acute iron poisoning is, so option C, desferoxamine. So desferoxamine is the antidote of choice in acute iron poisoning when given in IM and IV route. So overload of iron excess happens in the blood. So in that case, for the removal of the excess iron, we are giving this dexferoxamine as the antidote. Which iron chelator is prepared in chronic iron overload as seen in thalassemia? So option C, D-ferriprone. So D-ferriprone is an oral chelating agent used in chronic iron overload condition. So next is the iron preparation compounds. Ferrous sulfate. So read the synonym of this each compound. Ferrous sulfate, green vitriol, ferrous fumarate, iron fumarate, and ascorbate, iron gluconate, and carbonyl ion is the elemental ion, and these two are very important. Ferrous is the green vitriol, carbonyl is the elemental ion. So you read the preparations and assay yourself by taking screenshot. But very important, assays are all the iron compounds are assayed by stereometry and permanganometry by redox titrations only. So these are all the medicinal uses of the each compound. So all the iron compounds is used for the iron deficiency anemia. Copperase is a synonym for option C, ferrous sulfate. So copperase is green vitriol and ferrous sulfate is commonly known as copperase or green vitriol. Iron fumarate refers to, so option B, ferrous fumarate. Ammonium ferric citrate is another name for, so option C, ferric ammonium citrate. According to Indian Pharmacopoeia, the assay of ferrous sulfate is carried out by option C, stereometry. So redox titration by stereometry for the assay of ferrous sulfate. Ferrous sulfate has the molecular formula option C, FeSO4 7H2O. Ferrous sulfate is prepared by, so option C, iron dissolved in dilute sulfuric acid followed by crystallization. Which iron preparation has higher elemental iron content? So option D, carbonyl iron. So ferrous fumarate containing higher percentage of elemental iron. Ferrous fumarate is a higher percentage of elemental iron, making it potential oral haematinics. So than ferrous fumarate, carbonyl iron, it has more iron, elemental iron. Ferric ammonium citrate is mainly used. So option A, in patients intolerant to ferrous salt. Which iron preparation shows better absorption with reduced GI irritation? So option C, ferrous ascorbate. So ferrous ascorbate provides improved absorption due to ascorbic acid and causes less GI irritation. Ferrous gluconate is prepared in pediatric and geriatric patient because option C, it is a mild and well tolerated. The principal storage form of iron in the body is, so answer in the comment box. Thank you. All of you join in our WhatsApp community. You will get hands-out material. Thank you. Like, subscribe and share.